If you're thinking of pursuing a career in public health as a manager, as a leader, as an advocate, as an influencer, rather than an academic researcher, then the DRPH is the program for you.
The DRPH is a professional doctorate, which is intended really for leaders or future leaders in public health. So within the Research Degrees programme at the London School, we've been offering the DRPH as an alternative to the PhD since 1996. Over the last 10 or 20 years or so, there's been a big expansion of DRPH programmes around the world, and now there's quite a few institutions which offer a DRPH programme. And so we're at a stage now where the DRPH is a widely recognised degree, and as a doctorate, it's on a par with a PhD.
So I decided to come to the London School of Hygiene and Tropical Medicine because it's one of the most prestigious public health schools in the world.
This school has the biggest scope and the biggest remit, and to look at whole countries, and is of course a top class institution, so I decided to go for the best.
The DRPH is an ambitious program. It's in 3 basic parts. First part is talk component, lasts approximately 10 weeks, based in London. At the moment we feel that provides really the best experience. So it's the one part of the program when students are required to be in London to do face-to-face work.
I'd say this school is a very inspiring place to be. The location of Bloomsbury is kind of the hub of academia in London, so it's nice to be located right in the heart of that.
The students on the DRPH program come from every part of the world, so in any particular year we might have a dozen new students from a dozen countries. So I think one of the attractions from students of the face-to-face elements of the talk course is being over a 10-week period with a small group of people who, like you, are passionate about making a difference in public health.
It's nice to be around people who have the same values and interests as you. I've met a ton of new friends from around the world who share the same perspective of me, and I've made some lifelong friendships.
The great thing about a DRPH is students who come to do the DRPH have extremely diverse backgrounds. So they come from all over the world, and they come from all sorts of different backgrounds in terms of their professional careers.
The second phase of the DRPH is the organisational and policy analysis. And essentially what the student does in that second phase is they go and work in or with a public health organisation of their choosing. We don't identify the organisation for the student, though we help the student. When the student's there, they may be doing some work for the organisation, but they're also doing an analysis, we hope, of something that the organisation is concerned about, of the way in which the organisation is structured and organised and managed, and or the way that it is pursuing its mission to influence public health policy and practice.
It's a really great project in the sense that you use public health theories as well as organizational and business management theories to really assess organizations. You gain experience in leadership, management, and it's quite an applicable way to become a public health leader.
In terms of my organizational and policy analysis, I got allocated a position as a researcher at the National Institute for Health and Care Excellence. It has been quite a great opportunity for me because when I firstly arrived, I had previously senior managing positions and a preliminary interest in HTA. And nowadays, after conducting the OPA, producing a paper for the Ministry of Health of my country, actually I got appointed as CEO of the first Health Technology Assessment Institute in Spanish-speaking America. So it was like a whole thing meant to be.
After the OPA, students move on to the third component of the DRPH, which is the largest component, and that's the research thesis. Now, the research thesis can be on any topic covered by the school, anything which is public health relevant.
If I were to give advice to prospective students, I would say find an area of which you're interested and use the school's website to find researchers who work in that area. Do a bit of background work, read their publications, see their topics of interest, and then reach out to supervisors. It's intimidating at first, but everyone's very friendly, and if it's not them that will work with you, they can recommend somebody else quite easily.
In terms of applying for a DRPH, the process is very similar to that of a PhD. And essentially, the key to success in terms of getting into the building is really to identify a suitable supervisor who can backstop your research.
Now, normally the supervisor is chosen as the person who's most likely to be able to be the principal support during the thesis phase, But obviously that supervisor is also available throughout the rest of the program. And because it's a school-wide program, there is a program director whose responsibility is to ensure that all the students right throughout the program have appropriate support.
I have a wonderful supervisor who I can't speak highly enough. She's supportive and encouraging, and yeah, definitely some wonderful and brilliant people here at the school.
I think the school is so interesting because you have the naive romanticism of trying to save the world, and on the other hand, the realistic constraints of the economic crisis or budget constraints on or capacity. So it's all the time like trying to move between two worlds and the challenges on how to succeed and produce incremental changes and improvements in public health, bearing in mind those both aspects.
I think for young people looking to gain leadership experience, the program is very helpful in that sense.
The ability to plan, the ability to analyze stakeholders, the ability to use strategies to move things forward, the ability to become a policy entrepreneur, the ability to be a good leader. I would say those are the ones that I'm taking back home.